Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochkea Eskam SLFNHA Visionkade. Wiindamekewinan, Keguns Wichi Guyagban, Ima Ishkunaganang Kazgabeshig, Egochkea Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Anishinaabe Department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bojo waje gidna egama ngagaku gajmawe ogama kegunenan iwenun akuzib mujgaunan Wiindamekewinan Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Reese tell us about the Community Health Worker Diabetes Program at the Sioux Lookout First Nations Health Authority. Welcome, Reese. Ego ktsibujo waje gidnguna mina gaiseg je Wiindamekewinan ego awe Reese isn't kaz ahin kawi Wiindamekewiak iwe joga apnewen and Kiiwetinoong ahin ishkungangas danan Kiiwa jaunug anepia seg iwe Wiindamekewinan ahin Sioux Lookout First Nation Health Authority Gajgadig Wiindamekewinan. Bojo waje gidngo Reese.
Miigwech for having me today. I am excited to speak about the work that we are doing.
Thank you. Kaya shen nungum gagisgak. And chicken dance doesn't the man and Kiiwetinoong gatutamang.
Let's start at the beginning. What led to the creation of the Community Health Worker Diabetes Program? Ego mi Wiindamekewi nistam andegagun jamaat seg iwe and Kiiwetinoong iwe he joga apnewen and Kiiwetinoong nungum gabim yan khajgadig.
Looking back, there were several chief resolutions aimed toward SLFNHA to support community-based capacity for diabetes management, which resulted in focusing on community health workers, which can be ADI, CHR, early years educator, or basically anyone who lives and works in the community. Research and community input was done to review community-based best practices and how that information could be used to pilot this type of work in Indigenous communities in Canada. A pilot project to undertake this work began in partnership with the University of Toronto and Dignitas International in 4 communities early in 2016, which were Slate Falls First Nation, Casablanca Lake First Nation, Kiiwetinoong First Nation, and Kingfisher Lake. In partnership with these 4 communities and external organizations, this led to creating this one-of-a-kind training and support program for these community health workers in the SLFNHA catchment area. Programs similar to ours are really rare, especially in Canada, which I think sets our work apart from other departments.
Kiwe abian anda ki ayawan ogamakan and Kiiwetinoong SLFNHA ewid gabawi dawinch a bewinning so gawa benewen kashkehoen chedebenang midashima kadashimendo a bewinning SLFNHA and kinaganak Begawia ga anokit mina hima ga kabeshit ki nanan dawin chigate mina and sininoak ogi kano tanawa mawat keshimin sek mina keshi kochi abat chigate howe and Kiiwetinoong and Sinikang Pinch Canada. Ekkodistikaatek huwe Kiiwen. Wiindamekewinan University of Toronto, Mina Dignitas International, Mina Niwen Apawanak, Ka Matakantik 2016, Slate Falls, Savannah, Kingfisher, Mina Ki. Ka Wiindamekewinan Apawanak, Mina Agotjahi Wiindamekewinak Ki Unjase Epeshikwewanagak Anukiwe Kikinohamagewan Mina ke Wichikoat SLFNHA and Kinaganak. Anukiwe Wiidamekewinan ka isinagwatoyang kawan kutak tisinagwak Homa Canada. Apits Pakan isinagwan nandabat tigeunanan.
Wow, thank you for sharing. What is the purpose of the Community Health Worker Diabetes Program? Miwa majugumuntago niwe migwachkidnugo andash aninige Kiinabadakiwe ahi sugaapnewen and Kiiwen gajgadik.
The purpose is to enhance community-based diabetes management, both to prevent type 2 diabetes and to improve the lives and outcomes of people with type 2 diabetes in the Sioux region. The program does this by aiming to empower these community health workers to be a trusted and consistent support for those affected by diabetes in community. Continuity of care is a huge gap in health services provided to communities, with health care providers constantly changing and flying in and out of these communities. There is a lack of continuous stream of support for clients. That is where these CHWs come in, and our program is here to support them in their everyday responsibilities, as well as providing learning opportunities to enhance their already robust skill set. CHWs act as a bridge to clients by connecting clients with community-based or external organizations to get the support that they need. In addition, CHWs have a role in health promotion, delivering this important, specific to each community needs. Our program works with anyone who takes on more of a diabetes care role in their community. Often this is an ADI or the CHR. Since the program's conception, we started out in 4 communities, and now we have expanded to 21 communities in our region, with the goal to engage with more communities each year. Typically, we do a call out to community leadership the beginning of the calendar year to find out where interest and support is needed. From there, we work with community leadership and workers to do a community capacity assessment, which gives us a snapshot of what is happening in the community as it relates to diabetes management and support, what programs are in place and what are doing well, but also what supports are available in community where the strengths are and where there are any potential gaps.
Wiindamekewinan Wiindamekewinan Kiiwetinoong type 2 Wiindamekewinan Mina Kiiwetinoong Minno Ayanich type 2 ga inahpinench wana nawangang nekehi mihuwe Wiindamekewinan Mashkawisiwan nene eminach otanokin chite pakenemench mina monshak chiwijhat usogawahpinen apuwanen kwayak akosiwu kanawen chigewen kawen wuzepad sesenon apuwanen mashkikwek monshaka moche mamishkochiwach, mina ka pitatakwashwach, mina mamachiashwach apunang. Ega kwayak ewich hindo utahkuzik. Mihima shkunganang anukinagan. Kashe apatisich. Mina Wiindamekewinan. Inapatan chewiche hangich. Wiindamekewinan. Kaye ekikinohama wangich. Awasme chikkentang Wiindamekewinan. Apewaneng ahkusiwe anukinagan. Wichihan utahkusin pinchi apewan. Nanda agwachiahi che untenang wichiwewanene ka antawentang. Kaye iskunaganang anukinagan inanuki che kanutang minu yawanene. Huwenene chinach apewanan ka sinudesendich. Ne wichiwewanenan wichihan Pikowian, Usogawapanen ka Wiindamekewinan apewaning. Kegat musak wahawe ka inench. Anesinanikan sogawapanewan wichiwewan nanda iskunaganang anukinagan. Kamach chigatek wichiwewan. Ningi ayawamen niwen apewanak. Mina nungom nindayawamen nisitana pesik apewanak. Midas nachike yank. Mishin kiabit wi jihangit apewanak. Mi chike yank. Ninganunamen Ogmahkan ka oshke akiwak. Eka kwetoyang awanen ka chikendang mina ante wichiwewen ese antawentago. Mita shima ogmak ne Wiindamekewinan mina anokinaganak. Che nananda wene mento Wiindamekewi kekenda ma winoa. Ewenche wapantamang ese pembawichikatek sogawa penewen mina wichiwewen. Kekunen wichiwewen eyatek mina minusek. Kekunen wichiwewen eyag apewaning. Ante ese mashkawuzima gak mina ante ese panesek.
Good day, everyone. My name is Dr. Lloyd Douglas, and I'm the public health physician here at the Sioux Lookout First Nations Health Authority. I want to talk to you about routine vaccinations. Our communities are strongest when we take care of each other, and that includes staying up to date with routine vaccination. Lately, diseases like measles are making a comeback in Ontario and in Manitoba and all across Canada. These illnesses spread fast, and without vaccines, they can cause serious complications, even death. But measles isn't the only concern. Other vaccine-preventable illnesses like whooping cough, mumps, or even certain types of meningitis can also threaten our health, especially for children, elders, and those with weaker immune systems. Routine immunizations help our bodies build protection before we're exposed. Vaccines are safe, tested, and free. Most are given during childhood, starting at 2 months, then continuing into school age. They are also important boosters for teens and adults. And if you missed any, it's never too late to catch up. Whether you're planning a trip, heading back to school, or just want peace of mind, now is the time to check your immunization records. Let's protect what matters most: children, elders, and your way of life. Talk to your healthcare provider or nursing station about routine immunizations. If you have questions, you can also email us at acwinfo@slfna.com. Protect our past, safeguard our future. Keep up with your routine vaccinations. This message is brought to you by the Sioux Lookout First Nations Health Authority.
Thank you for sharing. What services does the CHW Diabetes Program provide? Miwa Kiiwetinoong Kiiwetinoong Kegunja weed stoapen gunja weed segen iwa ahi sugar apnel and kyun iwa ga gweb mutga dig ima binj ishinganen.
Our program provides training, mentoring, and support for CHWs. This includes offering fundamental diabetes education, hands-on skills training, and supplies and resources to help shape and support the program in each community. We have built a CHW network, which includes weekly check-ins where CHWs can meet and ask questions and learn from each other. Then, each year we hold a networking forum where we all gather and the CHWs can connect in person.
Wiindamekewinan ototan Kiiwetinoong napapange kiwin mina chiwit hinda apawanak apawaning kaye sugawa penewan Kiiwetinoong onnen jing chito tank o Kiiwetinoong mina abadstagan ke abadstuwat tasu apawanak. Ngiwanahtomen skunagan anukinagan kanon netawin. Taswais se jise pa pi tikituwat. Ante skunagan anukinagan Keisi nagishkatuach mina che kakwechemetuach mina chiwichituach. Egwa tasyake nengiche mawach hitamen mamaushkayank mina an skunaganang anukinaganak nagishkaw.
This is important work, training the trainers. Can you please speak more about the annual CHW Networking Forum? Miwa maujugu kchine daga niwa ankhuyun gab mujga dega ka wikagwe kinamaunda binjiskunaganang anin mayamge nankhuyat anin gestigat. Gadawin demosnamne kegunen niwa ka mamo ska jakhanu ahag suga panel and kyun ga mudwat.
Each year we hold our annual Community Health Worker Networking Forum, so workers from various communities can visit, listen, and learn from each other in person. We would like to hold the forum at the Onaman Zibi camp. The campgrounds have provided workers a bit of a break and a chance to decompress and relax. During our time at the camp, we provide learning opportunities for the CHWs, mostly revolving around self-care. This year, we are hosting a breathwork workshop where the CHWs will learn about how to regulate body and mind, while also using breath as a technique to help regulate blood sugars. We also typically have time with our knowledge keepers from SLFNHA's Anishinaabe Wiindamekewinan program. We do a medicine walk with Tom Shizzle and learn about which medicines can be used for regulating blood sugars, treating small wounds, and other diabetes-related conditions. This year will be our third annual CHW Networking Forum, providing a space for CHWs to connect and watching the relationships grow between the CHWs, which has been a beautiful thing to witness for all of us.
Tasyake Iskunaganang anukinagan mawad hituin. Tasyakke na mawad hituin kemin. Ahkusiwi anukinaganak pahpahkan ka unjiwach Kiiwetinoong Kiiwetinoong mina kikino hamatuach humaka bisawach. Nemenwentamen mawach tuyang onaman asibi kabeshunan anukinaganak omenwentanawa pangi ewanchi anweshinawach mina achna ekipchiwach. Mekwach kabeshiu kamakong ka ayayank ninki kikino hamawaman skunigan anukinagan kesi kanawe nemitisuwach. Nongkum ka akiwak niwi abadstomen pakitanamoen kikinohamagew chi kikentamohinch kwayak kesi kanawentang omiyo mina umamituninchikan iwekaye upakitanamo winche abadstuch chewinche minupinach umskwiwushokaman. Nindawasemen kaye chewitanuhkimangich kikendamawan ukanawen chikeman SLFNHA and snabewatasuwan wichiwewen. Maskikang nintishwinikomen Tom Chisel Wiindamekewinan kekunen maskike keki apatak chinisinench miskwiwishuka ke antaw huwemakak nanta kashkishin awiya mina kutagyan kishokam ka inahpinanik. Nongkum ka akiwak minisu akke skunikanang anukinagan chikche mamaw hituwin kech. Minangit skunikanang anukinagan kesi wichiwituach mina ekanawapamento emino wichiwituach mawach minoashin ewapanchigate.
Thank you for sharing this information. We love to see these partnerships at SLFNHA. How does your program support diabetes management in the communities we serve? Miwa ikchimigwachkidnugo iwa minukuka Wiindamekewinan iwa nun ankunan. Wajugo munendawan jikandawan kayan kwinanung anshinwag ego anshinabega wishinda. Anin meam einankuaj kagoge wichihawaj Kiiwetinoong iwedga kayawaj skunganung.
Our program provides hands-on diabetes training to CHWs. Diabetes basics training includes the standard diabetes education that aligns with Diabetes Canada guidelines. Hands-on training includes glucometers, how to check blood sugars, how to check blood pressure, basic foot assessments, flash glucose monitoring applications in troubleshooting, medication reviews, logbook reviews, and more. We have also partnered with external partners to host trainings which include Level 1 foot care, phlebotomy, which is the blood draws, gestational diabetes, and first aid. All of these efforts are aimed at enhancing the existing capacity of these CHWs and the community-based support for those living with diabetes. Diabetes sharing circles have also been a great success in some communities. It creates a safe space for those living with caring for someone with diabetes to share their stories, successes, and challenges. It provides community members the chance to learn from each other, to ask and answer questions. Those who have done this before in the sharing circles said they felt a sense of belonging and were surprised by how much knowledge they already had by answering questions from other people. Sharing circles have been known to help reduce the burden of diabetes on those living with or caring for someone with diabetes. Furthermore, it has been shown to reduce complications that arise from diabetes. The power of gathering and sharing stories is healing. We are always looking for feedback from communities on what training and resources are needed. Please do not hesitate to contact our program with your ideas.
Kiiwetinoong ominan sogawahpene we Kiiwetinoong skunaganang anukinagan Wiindamekewinan tutamuat sogawahpene nestamga Kiiwetinoong kigisin sogawahpene Kiiwetinoong Besigwan Canada usogawahpene unatsigewin chinta abadstut soga biwa bekune glucometer chinagadstut usogaman chinagadchat usogaman mina kesinagadstut opanka hugo Usitanche nanagatstot, Wanakin gas pasagwatinigatik ayam chikewabik, Kimas kikiman che nanagatawin chigatikin, Kitishi ayawin nan, Kashi masinahaman. Chinana katawin chikateken minakya. Nangiwitan kimamen pahkan awia eki Kiiwetinoong kwayak che kanawin chikatek misit. Onchiskwe netesot ka kigiskawa sot. Usogawahpene mina ka bitsink awia shemaga we change kakina hoenwan ankiwinan unche we cha usogawahpene awasme kwayak chikana wen mitis kwahka bananawang kanochgewen mawach minse anda abuning minno pehtagse hawe no ka wichi ka peshimituach nanda ka kanawe nimach usogawahpene che tepachimuach ka she minsewach minagashi anim sewat tauset an shinne che onche kendang kaki is sen we chipematisa che kakwetwich mina ashtentang ukakwetimegona kaki kipitapewach kaki kipitapewach iketowak hima ewenjiwach ki inamanche hoak mina uki koshkwentana anemenekok asa kikenda maunene ka ayawach ka asdenta moach awian ka Kiiwetinoong ka wahka penanuank isik kenchigate ehunch nangenegemakak awiyaka wichikapeshimach nandaka kanawenemach sukawahpene nakwan eka awashme ehunche kesche ahkoshkakoch usuga ka mawantoshkanwank minaka achimohtatnanu mawat kikehiwemaka moshak ne nanantunam utachimowinawa apiwanak kekonenen entawenta moach enon tesewa kawan pemanachi kanon shinam kekon mametunentame.
Hi, my name is Lloyd Douglas, and I'm the public health physician here at the Sioux First Nations Health Authority. I want to talk to you today about measles. Measles is back in Canada, and it's spreading. In places like Thunder Bay, towns in Manitoba, and other nearby communities, measles cases have been confirmed. And if you're not protected, you could get sick or pass it to someone you love. Measles spreads through the air from coughing, sneezing, or even touching a surface like a doorknob. It's so contagious that 9 out of 10 unvaccinated people will get it if they're exposed. Symptoms include cough, high fever, runny nose, red eyes, and a rash. But it's not just a rash. Measles can lead to pneumonia, brain swelling, or worse. Even healthy people can get very sick. The good news: we have a powerful tool to protect our families and communities: the measles vaccine. The vaccine is safe, effective, and free. Children should get one dose at 12 to 15 months and another dose at 4 to 6 years. If you're traveling even to nearby towns, babies as young as 6 months can get a temporary early shot too if there's measles in that location. If you or your children have missed routine shots, now's the time to catch up. Measles doesn't wait. Talk to your local healthcare provider or email acwinfo@slipna.com to learn more. Let's protect each other. Be a good relative. Get vaccinated. This message is brought to you by the Sioux First Nations Health Authority.
Save the date for Sioux First Nation Health Authority's AGM, happening September 10th and 11th in Lac Sioux First Nation. For more information, please visit slipna.com or visit our Facebook page.
That's amazing work you are doing. What initiatives support diabetes prevention in your program? Miwa maujugu kchine dawen yue anhuin gab mujgadig. Kegunenan ehayagen kegunj wichin dawenug kazuga apnaj. Nanda chuga kaye egad zuga apnaj. Egad jigach nguajue zuga apnon.
We partner with other programs and departments at SLFNHA to deliver health promotion and healthy living activities in schools and for youth and younger generations. We provide guidance and resources to encourage CHWs to facilitate healthy living workshops and other activities for their communities, such as cooking workshops, sharing circles, screening events, community gardens, and greenhouses. Programs that have collaborated with us include SLFNHA's Preventing Chronic Diseases, Raising Adult Children, Primary Care Team in the Anishinaabe Wadiziwin departments. We have recently obtained retinal screening devices which use smart technology to screen for retinopathy, which is a disease of the eye that can arise from complications with diabetes. We plan to train CHWs from any community interested in the SLFNHA catchment area to use these devices so that they can run screening events in their own communities. This initiative aims to reduce barriers in receiving eye care in communities to prevent further complications for those living with diabetes.
Wiindamekewinan bahkan Wiindamekewinan an Kiiwetinoong che Kiiwetinoong menno Wiindamekewinan mina keshe menno wahkawiwat wotskonik mina apnoji shak kaye skatazak nemami non mamen mina neminamen ke abatstuat skunaganang anukinaganak ke tutamuach we baskawat nanta kutagian Kiiwetinoong tabskut kisite powik kanhomagewen wahkapewen ahkusewen ka nananta wen chikatek apewen Kiiwetinoong apewen Kiiwetinoong mina Kiiwetinoong Wiindamekewinan kaki Wiindamekewinan preventing chronic disease, raising our children, primary care team, mina an sinapewatesuan. Nongkamike ningi untanamen uchap kewenche nanagatstoyank. Mamantawapik che nanantunamang ahkusitchapuwen ka unchimagak awiya ka shugawahpinich. Nawi kikinohamawamen iskunigan anokinagan. Pekwante apawanan ka unchiwach ka masawin tang chiki kiken tang kepan SLFNHA opimawuchikewinan neke che apachtuwach che nananto na wawach ka akuze chapinich. Howe match chikewin owi ni sanan kibishkikewin ochapewan che nanagachigatenik ochapewa apewinink eka awashme chikchi akusich ushogawahpenewe.
Miigwech Reese, again for the work that you are doing is very important. It's very important to understand what the CHWs are doing in community. If a community was interested in receiving your services, what would they have to do? Miwe mawajugu kchimigwech kidnugu iwe gaisig nugum Wiindamekewinan iwe nunankuyunan gab mujgade in Reese ega mawajugu kchinendao iwe ahi kagwe wichinda gazuga apnaj. Kishpin awiya adga ishkunagananga kagabeshij kaunjij. Ani nige dudangban ani nige sigepan iwen kagweded juichi hinj iwen ahi zuga apneo nunja.
No worries, Charles. I am more than happy to come and talk to you to explain the work that we are doing throughout the 33 communities that SLFNHA serves. Communities who are interested in our program can email us at chw@slfnha.org. diabetes, all one word, at SLFNHA.com, or call us at 807-738-2989. For more information, be sure to also check out our website at chwconnect, all one word, .ca.
Gawan Kachine dan Charles, Namanundan to Wiindamekewinan, Kiiwetinoong, Ewit Hangat, Sumadanasan, Sushab, Abunak, SLFNHA Ga, and Ganach. Abunak Ga Masawin, Damuaj, Newid, Kiiwetinoong, Biwa Bekong, Mazenhamaushanam, CHW Diabetes at SLFNHA.com. Nanta Piketun 807-738-2989. Yabawik Kendaman Inapan Pinsipiwabik. chwconnect.ca.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfnha.com. Miapanugiwa atibseg noom imaga Wiindamekewinan akwazio ankyun gabmujgadig ima SLFNHA Radio Connect. Mawajugu aikad nanun ishunganan Suidan Kumanda Anshinwagega Anshinabeg Egotske Anin Gegizwichiguemban Ewa Akwazio Ankun Gabmujgade Migat.
Recorded and produced at Wawatay Communications Society.